This video will show you how to wrap your leg as part of your lymphedema management. First, here are the materials you will be using. 1 roll of elastomol if we are wrapping the toes. 1 roll of 8 cm Comperlon bandage or any comparable short stretch bandage. 5 to 8 rolls of 10 cm Comperlon bandages. 2 to 4 rolls of foam padding. Cotton stocking. You will also need 8 to 10 pieces of masking tape. Have all your bandages and tape ready on a table in front of you. Let's begin. Put on the cotton stocking over your leg. Fold the ends over your foot if you will be wrapping the toes. Otherwise, proceed to Step 2, which describes applying the foam padding. Step 1. Bandaging the toes. Take the elastomol, holding the roll in your hand with the loose end towards the floor, or like a snail. Gently wrap the elastomol around the base of your toes. Do this once or twice to anchor it. With the elastomol back on top of your foot, direct the elastomol toward the big toe and wrap it twice. On the last turn, direct the elastomol towards the outside of the toe back on top of your foot, towards the other side of the foot. Go under the foot, then direct it toward the next toe and wrap twice. On the last turn, the elastomol ends up between your next 2 toes. Go in the same direction. Go under the foot and the opposite side. Use the same technique for the 3rd toe. Then, direct the elastomol toward the last toes and wrap them together or leave the little toe open. Go in the same direction and wrap the rest of the bandage around the forefoot. Pull the cotton stocking over your toes. Step 2. Applying foam padding. The foam is used to pad the leg and make it more cylindrical. It reduces the bottleneck effect at the ankle. Cut a rectangular piece of foam the length of your foot. Place the rectangular piece of foam on top of your foot. Hold the roll of foam in your hand with the loose end toward the floor or like a snail. Wrap the foam padding around your ankle, keeping your heel free. Wrap your leg in a spiral pattern using as many foam rolls as needed. Slant the foam to cover the side of the hip. Fold both ends of the cotton stocking over the foam padding. Do not apply tape to the foam padding or stocking. Step 3. Applying bandages. We will use the Comprelon and tape next. Start by sitting with your affected foot propped on another chair, a table, the bed, or any flat surface. Take the 8 cm Comprelon in your hand with the loose end towards the floor or like a snail. Place the bandage over the end foot and wrap just above your toes 5 times. Make sure the bandage does not go past the toes. On the last turn, take the bandage across the top of the foot to the level of the ankle on the opposite side. Keep the foot up or in a 90-degree angle. Turn it behind the ankle and then across the foot towards the opposite side of the forefoot at the base of your toes. This creates a triangle at the top of the foot. Repeat this, starting a bit higher up on the foot until you use up the bandage. This will create a basket weave pattern over the top of your foot. Secure the end of the bandage with tape. Your heel should be left open and not be wrapped at this time. Take the 10 cm bandage and anchor around the ankle 1 time. Then, from the top of the foot, cover the heel with the bandage and cover the bandage above and below the heel on the next 2 turns. This will create another triangle at the heel. Take your bandage and wrap up the leg using a spiral pattern covering the bandage 50% on each turn. Secure the bandage with tape. Gently squeeze your lower leg with your hand. Start the next bandage where you feel it getting softer, usually a little higher up the ankle. Place at an angle and secure it with tape. Wrap spiraling up the leg, covering 50% of the bandage each turn. When you get to the knee, bend the knee a little bit and perform a figure 8 at the knee joint. Use tape to secure the other end of the bandage. Gently squeeze your leg with your hand. Start the next bandage where you feel it getting softer. Continue spiraling up the leg, overlapping 50%. Continue the same technique until you cover the whole leg. Secure the end of the bandages with more tape. Gently squeeze your leg with your hand. Start the next bandage where you feel it getting softer. Secure the end of the bandages with more tape. Fold the top of the cotton stocking over the bandaged leg. You have successfully bandaged your leg to manage lymphedema. Make sure you can bend the knee and the ankle without any pain or difficulty. It is normal for the bandages to feel snug, never painful. Your therapist may teach you techniques specific to your condition. If you have any questions, please contact your therapist.